the unexpected truth behind lab testing and how you can use this to improve your health. My name is Dr. Thomas Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida, and I've had the opportunity to see over 100,000 patient visits over the last 37 years. And one of the main ways I determine someone's root causes in order to help them is through comprehensive lab testing. And what many people don't realize is when they go to their doctors and get testing done, it is just very basic and looking only for a few different things. So what you get is the CBC, chemistry panel, lipids, and TSH. They're looking for high cholesterol, diabetes, thyroid issue. So anything beyond that is being missed. So when you go in and you're having fatigue and gut issues, pain, headaches, maybe insomnia, anxiety, and they just check these things, and it's very comprehensive. They say, checking everything. They're really only looking for those three things, and if you don't fall into that category, which many don't, then they say, no, well, everything's fine, your lab work looks good, it must all be in your head, so why don't you just take this antidepressants or take this for anxiety. Oh, you're tired, lack of focus, concentration, take some Adderall, that'll help that. Eczema, so take this medication. You're just kind of left not knowing what's going on and thinking it's all in your head, you must be depressed, and just feeling even worse about it. And as far as your gut, oh, take some antacids. There's really no one looking for the cause of this. Coincidentally, the top 3 prescribed medications in the United States are statin drugs for cholesterol, levothyroxine or Synthroid for hypothyroidism, and metformin for diabetes. And those are the only 3 things they check for, okay? So what I like to do is take a comprehensive approach. At the minimum, when you get lab testing, what I would suggest is getting besides these 3, and I'll give an example. I have a 26-year-old woman who came in to see me who was having fatigue, anxiety, gut symptoms, pain, headaches, insomnia, eczema, just feeling miserable. She was couldn't lose any weight. She was overweight. So when I did this panel, I also checked iron levels. So she had low ferritin, low iron, low saturation. You also want to check CRP, GGT, LDH, ANA. So in this, she had high CRP, indicating inflammation, ANA, which is an autoimmune marker, which was high at 26 years old. Elevated uric acid, which can contribute to joint pain and inflammation, and her thyroid. Besides TSH, it's important to check all these other factors, free T3, free T4, thyroid antibodies. Those were normal on her. DHEA, cortisol for adrenals. She had high testosterone, which caused its own set of issues. We checked these other hormones as well. And then checking when you get this panel, if you get at least check some of these basic 3 or 4 vitamins, D, B12, folic acid, red blood cell magnesium, and homocysteine, that would be helpful. So when I get these results back and see these findings, a question I like to go further, say, well, what's causing high ANA? What's causing this autoimmune condition? What's causing the inflammation, the low iron? So all of these issues, I like to take a root cause approach and get some functional testing. And the 5 main areas are deficiencies, toxins, infections, hormonal imbalance, and food reactions. So in her case, under deficiency, she had multiple deficiencies, including vitamin A, which is really important for your skin, as well as she was below optimal and many other ones, some of the other B vitamins, C, E, also important for your skin. Toxins, she had high levels of certain heavy metal, infections, she had candida, yeast overgrowth, which can lead to gut symptoms, as well as skin reactions like eczema, brain fog. Hormonal imbalance, she had low levels of adrenal hormones, as well as a certain type of estrogen was very high on her, and food reactions, very high gluten sensitivity, as well as sensitivity to other foods like yeast, dairy, and almonds. Also had leaky gut on top of that, and high inflammatory markers in her gut. So all this was going on. So then now that we know what the root causes are, we can then work on solutions, and I do this through diet and supplements. And the diet I came up with years ago when I was dealing with how to help myself with autoimmune conditions. I had Hashimoto's and elevated rheumatoid antibodies, as well as chronic gut issues, IBS, fatigue, just skin issues. So I was figuring out how I was able to get better from that. And the diet, which I call the free diet, is not only free of gluten, but gluten, grains, sugar, yeast, dairy, eggs, soy, legumes, nightshades, and processed foods. So free of all those foods most commonly responsible for inflammation, gut, and other chronic health issues. If you want a copy of the free diet phase 1 food chart, I'll put a link below for you. And so the diet, as well as supplements, our natural medicine formulas, I start with the functional 5, which is multi-fish oil, vitamin D with K, magnesium, and probiotic. And then other things, depending on findings, like curcumin, which helps with that inflammatory support, gut support, as well as nutrients for the deficiencies she was having, including some of the B vitamins, C, E, A, selenium, which she was low in, adrenal and hormone support for that, metal cleanse to support her issues with heavy metals, and liver support to help support detoxification. And had her on that, and after 4 weeks, we did this one test over to check her progress. And what were the results? Well, her ANA, or autoimmune marker, was negative, completely fine after a month. Inflammatory marker, CRP, went down to normal, went down 70%. Also normalized was her uric acid, liver enzymes, testosterone, which was too high. That's normal. Iron, ferritin, saturation all came up to normal levels. And her gut symptoms improved. Eczema was better. And she dropped 17 pounds in that first month. And at 3 months, dropped 26 pounds, reached her goal weight. So she was thrilled about that. Her eczema was cleared up, and her gut was better. So she was just doing so much better. And so that's what I'm recommending. Instead of just checking a few different things, you want to at least get a comprehensive health panel. And beyond that, if you want to get to the root causes, check these 5 main areas: deficiencies, toxins, infections, hormonal imbalance, food reactions. And if you're provided the root causes, then you can be provided the right solutions. And if you do so, I believe almost anyone can get better. So thanks for joining me today. I'll leave a link below for the free diet phase 1 food chart for you, and feel free to like and subscribe, and I look forward to seeing you next time. Take care.